depression I will discuss. So listen carefully. Okay. So antidepressants are, this is the heading. Okay. So which reducing the depression. Okay. So what is depression? First you have to know. Depression is nothing but mood swinging. Means you are not able to be at a constant mood. Constant mood in the sense is nothing but which is moderate mood, which is allowing you to do each and every activities in daily life as normal. So if someone is getting much more excited, or after excitement he is getting depression. So why it is happening? Because of nerves firing the neurotransmitters more in the brain. So some neurotransmitters such as noradrenaline, Na, dopamine, Da, and serotonin, 5-HT. Chemical name, scientific name is 5-HT, serotonin. So mainly two neurotransmitters is responsible for mood changes. One is dopamine, another one is serotonin. And for happy moments, serotonin is more responsible. And for reward system, dopamine is more responsible. And for adrenaline, noradrenaline is responsible for alertness. Okay, so different types of neurotransmitters are having different specific reason to work, to function in our system, nervous system. Okay, so here I have written depression is a very common clinical condition associated with feeling. So this is clinical condition and which is associated with feeling of sadness. If someone is getting sadness due to his failure or his unsuccessful in some task or some work or in examination, so that may cause sadness. The loss of interest. So if someone is not working properly, daily activities are not doing regular, then it will cause, definitely at certain stage, after certain time, he will face some problem, and that problem will cause sadness. And that will cause sadness means whatever you expected the result after doing some good work, if you are not getting that particular result positively, then you may get sadness. So by that way you may get loss of interest in that activity. For common example is examination. Most of the students are not properly studying, okay, after getting lecture, after listening lecture, and during lecture also they are not properly listening, and all other activities they are doing properly, but regarding mental tasks they are avoiding. So whenever exams are coming, so they are trying to do more hard work while at the time of exam, but previously. So what will happen? It may cause pressure on the brain, and which will increase the neurotransmitters to release more, like acetylcholine, dopamine, these things. So your body functions will be totally altered, sleep cycle will be totally altered. So at the time of pressure, when you are going to face the examination and you are not able to concentrate on the answers, so that you may get failure result and you will get sadness and loss of interest in that study. Okay, then you are going to neglect yourself, self neglect, not neglected by others but yourself. Means you are personally yourself getting neglected by your that activity. Okay, you are not going to taking any interest furthermore. Then anorexia means loss of appetite. So loss of appetite means you are not getting proper eating eagerness, means you are not interested to eat food properly. So anorexia will cause. Then sleep disturbances will cause. Then in severe cases, suicidal feelings also will come. Suicidal feelings also come. So at the depression's treatment, if this is happening, then treatment depends on the type and severity of the depression. So how much that person is going to depress. So according to his or her sadness or depression, there are certain types, different types of treatments. So there are two types of affective disorder, that is nothing but mood disorder, and indirectly, if we are going to say, that is called unipolar and bipolar disorder. Okay, sorry, unipolar depression and bipolar disorder. So unipolar, here name itself indicating that uni means you may get only single thing disturbed in your mind. Okay, so neurons in your mind, only single neurotransmitter may get disturbed, so that will cause unipolar depression. Bipolar means more than that one. Okay, so more than that symptom you are getting bipolar disorder. Okay, so in bipolar disorder, manic depressive psychosis will occur. So that is in short MDP. So this is episodic, means it may cause within a minutes or half an hour, like that, means regularly or frequently you may get the episodic. Then mania means more excitement you will get, shouting like that, and mania is, so by that way you are getting depressed. Okay, and this is unipolar reactive depression, and another one is endogenous depression, two types. Okay, so in reactive depression associated with stressful life events, whenever you are getting some stressful situations, so it will cause reactive depression. Means if someone is going to tell you that no, you do this one at this moment only, if you are not able to tolerate that word or that command, then you may get that reactive depression. Suppose certain professors are telling to students that you do this task immediately, but they may get stress. He may get stress, she may get stress. By that way, she or he may react, and by that way, after some time, he may get reactive depression. Then endogenous depression. This is phenotypic or genotypic, means it may come from parent. Okay, parents it may come. So genetical changes occurring in the body. So this is called genetic predisposition is present. Okay, means previously your forefather or your father or your mother might have that depression like symptoms, so you may get that one, or by environmental factors your genetic code may change and you are getting that one. Genetic predisposition you will get. Okay, then reactive depression, psychotherapy alone is enough sometimes for reactive depression treatment, and sometimes it need psychotherapy along with that one antidepressant medicine. So already I taught in previous video, you can watch that one, what is pharmacology. Okay, so you can go. Next one is endogenous depression. So for this treatment is antidepressants alone or sometimes with elective convulsive therapy. So electroconvulsive therapy is nothing but by giving electric shock. So in a tolerable amount, in a tolerable hold, the therapists are giving this one ECT, electroconvulsive therapy. So this is having side effect also, because it may damage permanently the neurotransmitters release or nerves in the brain. So he or she may get again coma or death. Right? So this is the consequences if treating with this one. Then MDP, bipolar depression. MD already I told here, manic depressive psychosis. Okay, so bipolar depression, more than one thing occurring. Okay, so here I drawn here graphs, two types. So I am coming there. So lithium is for treating bipolar depression and antidepressants and carbamazepine with or without ECT. So what is ECT? Already I told you, electroconvulsive therapy, right? So here you can see in a graph that if this is your normal mood, okay, if this is your normal mood, so after certain time when you are getting depression, your mood will be swing and get depressed. Then again certain time you are getting normal. Then again after certain time you are getting again depressed. Again a certain time you are getting normal mood. So this is nothing but unipolar depression. Okay, so depression alternates with periods of normal mood. So according to your mood, it is changing. So normal to depressed, normal to depressed. Okay, so here depression with normal. So this is two consequences for unipolar, means one type of situation is occurring. Here more than two types situations are occurring. So particularly here depression along with mania. Depression along with mania means you are too much getting depressed and again you are getting too much excited. So that is called mania. Okay, excitement or irritable mood. You are getting more irritations and you are shouting like that. And depressive means just calm down. So like that. So inferiority and superiority like that happening in the mood. So depression to mania, again mania to depression, again depression to mania, like that swingings. Then depression hereditary tendency. So this is mostly causing from hereditary sometimes. Drugs are nothing but antidepressant agents or antidepressant drugs or medications or medicine, right? So here number one classification is tricyclic antidepressant. Okay, so in that you can remember this one like mnemonics, means short tricks to remember the classification here. So anti for A for anti-depression means antidep. So A for amitriptyline. So this one A for amitriptyline. Then N for nortriptyline. And this is noradrenaline selective. Nortriptyline is a noradrenaline selective. So N for nortriptyline. Then T for trimipramine. Then I for imipramine. Then D for doxepin. So he left out. Then P for protriptyline. So like that you can remember this one. Then second classification is selective serotonin. So I will tell mechanism of action, how it is working on neurotransmitters later after telling all these things, all these points. So here second is the selective serotonin. So which is particularly targeting for serotonin receptor, serotonin neurotransmitter, that is chemically or scientifically known as 5-HT, 5-hydroxytryptamine. Okay. So selective serotonin 5-HT reuptake inhibitors means which is stopping the serotonin reuptake from the postsynaptic nerve, right? So this is in short SSRIs. Okay. Then example are fluoxetine, then citalopram, then paroxetine. So these are the drugs. Selective serotonin 5-HT reuptake inhibitors, which is inhibiting the reuptake of serotonin from the postsynaptic nerve. Okay. So I will explain this all mechanism of action. Then atypical antidepressants. Third one is atypical antidepressants. Number one, trazodone, then bupropion and aminoeptine, etc. And this is very important. Fourth classification is that MAO inhibitors. MAO inhibitors means monoamino oxidase A inhibitors. Number one example is moclobemide. Sorry, this is not moclo, this is meclobemide. Okay, and chlorgyline. Okay, so this is the drugs classification. So after completion of this one, I will focus on mechanism of action through diagram. So now cyclic antidepressants, what is the pharmacokinetic? How it is going to the body and how body is reacting for this one. So it is readily absorbed or good absorbed at GI, gastrointestinal tract. Then it is highly binded with plasma proteins, albumin-like proteins. Okay, then distributed nicely in tissues and CNS. So it can nicely distributed in tissues and CNS. Then metabolize in liver. Then few other drugs like TCA, means tricyclic antidepressants like imipramine and amitriptyline. These two drugs produce active metabolites. So these active metabolites will have long action for the patient. So long duration of action for the treatment. Though urine and through urine it is excreted and inactively, means inactive manner. So this is about pharmacokinetic. So what are the side effects? And tricyclic antidepressant side effect number 1 category is dryness of mouth, then blurred vision, then constipation, means you are not getting proper excretion of your feces. Okay, constipation, then urinary retention, etc. Second type of side effect is alpha receptors blocking, adrenergic blocking effect, means alpha 1 is the adrenergic receptor. This is also blocked by TCA. So postural hypotension, means hypotension will occur, tachycardia, heart rate will increase, and cardiac arrhythmias, means irregular heartbeat will occur. And third consequence is that H1 receptors blocking, okay, which is antihistamine receptor. Okay, sedation will occur, then confusion, then other, what are the other side effects? Weight gain and increase of appetite. So you may get more hunger. Then contraindications. Contraindications, this is very, very important to remember that these are contraindicated with glaucoma patients. What is glaucoma? So the patients who are having eye problem, okay, and if this patient is getting this medicine, then he or she may get blindness, permanent blindness with this side effect. And epilepsy already I discussed in previous video, so you can go through that one. An enlarged prostate, for male prostate gland is there, which is responsible for erectile function. Okay, so it will enlarge and may cause cancer, prostate cancer. Okay, which may cause infertility furthermore. So now about monoamino oxidase. So monoamino oxidase are of two types. Number 1, monoamino oxidase A. Number 2, monoamino oxidase B. So what is monoamino oxidase? This is the enzyme which is present at the surface of mitochondria. So this is mitochondrial enzyme. These are the two enzymes which are present in mitochondria. Other enzymes also present in mitochondria, which is responsible for generation of energy. Okay. So what will happen here? These enzymes will metabolize the biogenic amines. So what are biogenic amines? Now you have learned that serotonin, dopamine. So these are the biogenic amines. Okay, means monoamines. These are having amino group. So through amino acids, these are converted to dopamine, serotonin, noradrenaline, like tryptophan, phenylalanine, then these tyrosine. So these are the precursors which we are taking through food, and it is converted to monoamino acids or neurotransmitters. Okay, and those are nothing but biogenic amines. So these monoamino oxidases oxidizing these biogenic amines, means removing the amine and degrading the neurotransmitters. Okay, Then MAO A, monoamine oxidase A, metabolize noradrenaline, means degrading. Metabolizing means destroying, degrading. Okay. Then 5-HT means again serotonin. Okay. 5-hydroxytryptamine. Then tyramine. So these three neurotransmitters are get metabolized by MAO A, and MAO B metabolize selective for DA, means dopamine. Then meclobemide, already I told here, meclobemide MAO A inhibitor, which is selective. Meclobemide is a selective and reversible inhibitor. Okay, so selective and reversible inhibitor of MAO A, no side effect with food and no side effect with drug. Cheese reaction is rare. Sometimes with cheese it may cause reaction. Okay, so this is all about antidepressants and their classifications and their pharmacokinetic properties, side effects, and what is MAO and contraindications. Now I will tell about mechanism. Okay, so for all common, mechanism is common. So here I am drawing that one. So suppose this is nerve. This is nerve, presynaptic nerve, and this is postsynaptic nerve. And postsynaptic nerve are having receptors which are collecting the neurotransmitters from presynaptic nerve. Presynaptic nerve ending or terminal. Okay. Then this is postsynaptic nerve, postsynaptic nerve terminal, nerve body, this one. Okay, dendrite, actually dendrite. So when vesicles are containing neurotransmitters, so these are the neurotransmitters, so noradrenaline or serotonin. Okay, this is another name is 5-HT5-hydroxytryptamine. So when these vesicles are fused with the help of calcium ion, then releasing through this one gate, okay, then here releasing the neurotransmitters and attaching with the receptor. Okay, means for in postsynaptic nerve. So again the remaining neurotransmitters are getting reuptake by reuptaking mechanism. Okay, so if here blockage is occurring through there, where MAO inhibitors. Okay, so reuptake or MAO inhibitors here is there. MAO is here, which is degrading these neurotransmitters. So if MAO inhibitor is applying here, then it will cause stopping the degradation of the serotonin. Okay, so it will release perfectly and it will cause stimulation, so balancing the mood. And here tricyclic antidepressants. Okay, so this is the mechanism how it is working. So hope so that in this video you got the concept about antidepressants and their drug use. So if you like this video, please share and subscribe. Thank you.